So, all right, welcome everyone, and hello, friends. Welcome to another episode of your morning cup of Q and J. So, as you know, all know that last week we talked pretty in depth about racism, and today we are going to continue to talk about this topic of Black Lives Matter. Police brutality, but more focused on long-term change and the intersectionality of health equity. What's equity mean? So actually, before we start recording, Q and I were just talking about uh, why the saying "all life matters" is so fucking annoying. Q, can you guys share that story really fast?
Yeah, a friend of mine, her father-in-law passed away from COVID, and it that definitely affected her perception of COVID, you know. So, um, yes, I think earlier this week, she and her husband were both approached separately by two people who asked, like, "Oh, I heard about your father-in-law or father passing away." They both were like, "Yeah, it's from COVID." And both these people asked, well, how old was he? And they said 80. And then they said, oh, it was his time, or some kind of variation of it. I remember, I mean, she was upset, and her husband was, it's upsetting. And I remember thinking, I just said immediately, I'm like, that is insanely, incredibly ageist to say something like that.
Yes.
To say, like, oh, it was their time. Like, first off, this disease doesn't select who it kills,
No.
and then on top of that, it's deeply insensitive to say it's someone's time,
Yes.
especially. And then let's say in the best case scenario, it's like, oh, that's their way of showing they cared. I'm like, why didn't they ask how they were doing? Why didn't they ask, like, how are you doing? Are you okay?
Yeah.
No, instead they said it was their time. And
Yeah.
I also want to share, like, we had a hype in the Vietnamese community in Orange County recently. It's a very high profile case where a father and son both got COVID. The father lived and the son died. The father was 65, the son was 35. So, and, and like, honestly, like, the idea of, oh, only the elderly die really is an extension of only the weak die.
Yeah.
And that is not only ageist but incredibly ableist.
Mm-hmm.
Um,
Mm-hmm.
and it for me it's very because then it becomes, this whole idea of all lives matter always bothered me, because I'm like, well, clearly not all lives matter, because when you get people who instinctually say, like, oh, well, they were older, so it's time to die. I'm like, I would like to, like, I would really like you to tell it to the person who's about to die from COVID,
Yes.
who's older. Like, I would really like for you to tell it to their face, seriously.
Yes.
And then on top of that, like, obviously people, the idea of, like, well, only the people who are weak immune system are like, oh, well, they're weak, so they're gonna die. I'm like, that's ableist. Um,
Mm-hmm.
that's not how it works, honestly.
Yeah.
There's plenty of cases of people with COVID who died from COVID, no pre-existing condition, completely healthy, and they died. So this disease does
Exactly.
not
Yeah.
give a crap about where you're coming from. It's deadly.
Yes. And kind of go back to that, you know, that it was his time. And then what we were talking before we started recording is that my prejudice, my assumption is that I bet you most people say those things that it's his time to die. Or the weak one should die from this COVID-19. Should sacrifice. Like the governor of Texas actually said that those older people should sacrifice their life for the economy, something like that.
Hmm.
But those are probably the same people are poor life supporting, and then those are probably same people that support all life matters. And my reaction is like, fuck yeah, of course all lives matter, you douchebag. But have you noticed the disparity between all lives? You only focus on certain all lives. If you really care about all lives, how about the homeless people sleeping on the street during the winter time? How about those migrant children dying, getting sexually assaulted by those border agents? down in Texas and Arizona. How about if you really care about all lives, there's so many other people, lives that matter,
Mm-hmm.
just using this immigration itself, these kids and families are actually escaping, you know, and I bet escaping wars and famine and fear, and then we just kind of don't give a shit and lock them up, separate the family. And I
Yeah.
bet you they counter arguments that like, oh, when we mean all lives, we mean Americans. Then then you cannot say all lives matter. You have to change your language. It's American lives matter. Like
Yeah,
so,
and then at that point it becomes like, and then it gets very granular, because then it's like, well, people who are currently incarcerated, do they matter? They're like, oh, no, because
mhm,
prison labor is rampant. Prison labor is modern day slavery. They're paid
yes,
close to nothing for the amount of work they do. And then the people are like, oh, no, but they were bad people, they're incarcerated. So it's the idea of, and then just an extension of what we talked about last week, when people say respond to Black Lives Matter of all lives matter,
hmm,
it is a brazen disregard and willful ignorance of
yes,
a larger reality. That, yes, I would like to live in a world where all lives are equitable and equal. We ain't
hmm,
there yet. We just are
yes,
not. We it's so. And I saw a really good tweet that I laughed and went, ugh. So people have been trying to come up with different analogies. Like, this is what it's like when you respond to Black Lives Matter with All Lives Matter. It's like
hmm,
a house is on fire, and
yeah,
then
yeah, I saw
yeah,
that one
and then you go out, and then someone responds like, well, my house is right next to that house. Doesn't matter. But I remember I saw that tweet, and it said like, hey, folks, you don't need to keep making analogies about like Black Lives Matter for All Lives Matter people. It's like, they know, they're just racist. And I just sat
yes,
there and I went, yeah, because at some point, I have a benefit of the doubt. I'm like, somebody who means well, they really don't know. But for people, but when it becomes so obvious that you present evidence and reality of like, this is the reality right now,
hmm,
and there again it becomes like a willful ignorance.
hmm,
Then it's like, you can be a good person and you can be racist too, or quote unquote a good person. Like, you think you're a good person. And I think what has been really illuminating about this entire movement in lieu of George Floyd has
hmm,
been the people who have become defensive and said, well, I'm a good person. I'm a good person. And I'm like, no one, like, no one was saying you aren't. I'm like, it's bigger than you. We
yes,
all benefit. I mean, as Asian Americans, we benefit greatly from
hmm,
the activism of Black community leaders, the Black Panthers, Martin Luther King. We benefit significantly from their activism in the 60s. Like, the immigration reform that allowed for a larger influx and larger immigration from
hmm,
Asia. That's Black people in America, that we benefit directly from that. Me
yes,
me as a Vietnamese American, Black Americans advocated heavily on an ethical, moral quandary, saying we need to let Vietnamese
hmm,
refugees into the United States. There's an amazing piece of history,
yes,
historical newsletter that shows Black community leaders advocating. And a lot of people don't notice, because history is like, there's a lot of people who like to look at Vietnamese and go like, oh, it's an amazing American success story. And
hmm,
a lot of these same people purposely or just don't remember that the popularity, quote unquote, of letting Vietnamese into the United States was very low, like very low. And Black Americans were on the side of morality. They're like,
yes,
let them in. Jimmy Carter was like, I'm letting them in. I don't care if it's not popular. It's the right thing to do.
yes, yeah,
So I think it's so in kind of now in the present moment with everything going on, I go like, this is not a time to debate about quote unquote your personal goodness.
yes,
Like, you really want to be a good person, you sit down and really assess your values.
yes,
Like what you said, like, when these people who are so fucking annoying. He just always keeps saying all lives matter, all lives matter. I'm like,
Yeah.
do you care about people, migrant children in cages? They're like, no. You care about people who are incarcerated? No. Then you don't care about all lives. You care about
Yeah.
some lives.
Exactly. Yeah. And I think that this is really good segue into, how can we have long-term sustainable changes,
Mm-hmm.
and you mentioned really interesting certain human personalities, that defensiveness.
Mm-hmm.
Certain people, I don't know if you have friends or if you know people, when you just start saying something, when you say like, yeah, I know this person that's always very selfish and blah blah blah, and your friend immediately said, I'm not selfish, I'm not like that. I'm like, yo, bro, well, yo, sis, I'm not talking about you. Like they take things very personal. No matter what you say, they think that you are talking about them. Well, they immediately think about themselves, and they become very defensive. And this is one of the things that I think what's going on right now is that, yeah, people are getting very defensive because first, I think that there's so many different reasons, politically, so bipolar, blah, 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 all that. But I think as an educator, I think is the lack of education.
Mm-hmm.
It's a lack, using, I'm stealing Brene Brown's words. It's lack of curiosity because our society has been so complacent. We have become so comfortable within our comfort zones, within our own biases, within our own views, that we, for years, for decades, we don't do anything about it. We just think that this is it. This is the world. Therefore, when someone starts questioning your comfort zone, you start thinking that they're attacking you, even though they not even try to attack you.
Mm-hmm.
And for me, and then this is, and including myself, for a couple of years, I was doing really well. I have my own worldviews. I finally, quote unquote, start making it. Start achieving American dream. I start living in my own little privilege, whatever that means, even though I'm still not privileged. In my own privilege, whatever bubble. And when someone started questioning, questioning me or challenge me, I noticed that I would get more defensive, get more aggressive in response. And so to flip that around, back to this whole education, specifically using, the word by Brene Brown, that curiosity, is that how can we install this curiosity into people's education? I remember back in high school and college, we had to write papers on critical thinking. And I hate it. Back in the days, whenever a professor said critical thinking paper, I hate it. But looking back, I'm like, oh my God, we do need critical thinking. So, we need, and I think I love the word that Brene Brown used, curiosity. I think that's a
Mm-hmm.
way much better word than fucking stupid critical thinking, which is so
Oh
important.
yeah.
But I return to that education. Like curious about how did I make it? Like you were like what you were saying, that like relatively speaking, me and you, we have decent, okay life, as Asian American, and then so kind of question ourselves that how did we get here? And I love that you brought up that like this didn't just happen because we are the model minority myth, fuck that shit. This happened because so many things that supported our lives.
Mm-hmm.
No, don't get me wrong. Q, you worked hard.
Oh
I
yeah.
worked really hard. There's so many Asian Americans, so many people, Black Hispanic, that worked so hard to get to where they are right now. But that curiosity is that like, one example I love to use is that when I start giving diversity and inclusion training, sitting in a room in front of 25 white people giving diversity inclusion training. Just thinking back 50 years ago, an Asian man, an immigrant Asian man with an accent standing in front of them, giving a training, teaching them, it's almost impossible. That just
Mhm.
50 years ago. Dave
Mhm.
Chappelle's newest special.
Oh, did you watch it? The
Yes,
eight
remember?
four 8 minutes 46. Oh
Yes,
my
he
god, that
was
was
saying that like, and I love that he said that like when we think of slavery, we think that oh my god, it's ancient history.
mm-hmm.
But in his special, he just pointed out no, it's pretty close to him because I think his father's grandparents were slaves, and
Mm-hmm.
that is like pretty close.
Yeah.
And so yeah, so I think education is huge.
Yeah, and I think, I also really want to emphasize it's in education, a critical education, because, you people can get an education and like, oh, Christopher Columbus, blah, 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 came to
Oh
the
yeah.
United States, yeah, stuff like that. But a critical education involves, really encouraging curiosity. That is
Hmm.
so important. And I don't think that I think when people think education, they think, oh, I'm like, no, no, no. Education is piquing curiosity. And you know,
Hmm.
one of my favorite teachers in high school, he taught AP United States history, you know, and
Hmm.
a lot of my classmates disliked him. They're like, I don't know. He's like, I don't know what I'm supposed to study. And I don't know. I'm like, how am I supposed to get an A, blah, 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 typical like high achieving kid stuff.
Yes. Yeah.
I really, really liked him. He was funny, and I knew that a lot of my classmates were irritated at him because he wasn't teaching us to memorize history. He was teaching
Hmm.
us to go, read this, okay, now think about this. And one of my favorite lessons to this day, he goes, the Boston Tea Party, right? The idea, so this ongoing narrative in American history. It's like, oh yeah, we rebelled against the cruel English, blah, 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 right? And then the default is like, because taxes.
Hmm.
And then then he said like, okay, yeah. And, everyone responded like, taxes, taxes. Then he goes, really? And then I went, oh, I don't know. It's like, I don't know. And then he shows us the data. It's like, this is how much in England. This is how much in taxes. Like people in England were like, like giving back to the government. And here's how much in the United States they were giving
Oh
back.
yeah.
And it was drastic. It was a huge
Hmm.
difference. They were
Yes.
like paying so much more in the mainland or in England. So he goes like, so why would you rebel? Why would you rebel and start a war over this amount of taxes? And I still remember that lesson. Let's see. Oh my God. I still remember that lesson like 14 years later,
Hmm.
It's like, because it was such a great moment to be like, is this really what happened? Like, let's get curious. Let's actually look at the data. Let's look at the real historical documents. And he
Hmm.
always was like, be curious, be curious. Now, it drove my classmates nuts. It really did, because they're like, I want to know how to get an A. I want to know how to pass the AP examination.
Yes.
And I think a lot of people are in a mindset of short-term gains. Like, if I get an A, then I get into a good college, and then I get into a good degree, and then I get into a money, and blah blah blah. Is
Hmm.
that short term? And then they hit 30, and they're like, either they're married and everything's perfect, and they're like, I'm bored now, or they haven't met their goal, and they're like, I don't know. So,
Yes.
but I think our education system is at large very geared towards that, like, oh, your education is for a return, an economic return, and not an intellectual, and I think we really need to
Mhm.
expand the idea of what education is. I want more teachers in
Exactly.
and I mean, even I'm so sorry, Miss Elliott. So she wrote me my favorite teacher in high school. Her name is Miss Elliott. She wrote me a letter of rec. I read it. I wasn't supposed to, but I got curious. So I read it,
Uh-huh.
and I'm like, so sorry, but she gave it to me in this unsealed envelope. So of course I'm gonna read it. And I read it, and she said, said a lot of nice things, and I was like, oh. But the one thing she said that stood out to me, she said, Quinn is a student who doesn't get mad at you when you tell her to go look it up in a book. And it's true, because I remember
Nice.
there were so many times when I asked her a question, in biology, or, something biology related. And she said, have you looked in this book? And I said, oh, I haven't. Thank you so much. And I would go look, and, actual books. This is before, Wikipedia and everything.
Yeah, yeah.
So, and that for me was really great training. And I'm like, yes, it would have been so much easier if she just told me the answer. But she's like, no, why don't you go look it up? Like, go do the investigative, deductive, be curious, like expand your knowledge, your stretch knowledge base. That kind of education and training has stayed with me for the rest of my life. It's very formative, because so like
Exactly.
instead of like just someone telling me, feel like, and like so kind of tying it to now when I'm seeing people get defensive and go, don't tell me what to do. I'm a good person. Like, I don't know what white privilege is. I'm like, do you realize how easy it is to just look up this shit on Google? What is white
Yep.
privilege? And to have a critical mind, be like, who's the source of who's writing this? Is this some obviously, far right Fox News like leaning person, or is this someone with a PhD who specializes in this?
Hmm. Hmm.
It's like,
Yes.
are you verifying your sources? And I think, for me, I was very lucky to have teachers who were like, hey, be curious, think about it. They like spend some time like digesting critically what you're consuming
Hmm.
information wise. And I think that disparity, that this education and disparity across the United States is really showing when people go, I'm a good person, don't tell me, all lives matter. And you're like, come
Exactly.
on, man.
Which is also really sad. Like, and yes, and I think that moving on to, yeah, like all life matters versus Black Life Matter, or even hot topics like defund police, or guns, hot topics like pro guns, anti guns.
Mm-hmm.
And I think kind of tie it back to that curiosity will become very defensive. I think I remember a couple weeks ago, I was at my friend's place. We were just having dinner, and one of his buddies came over, and they love guns. They love so we started talking about, and my other friend was there too. So we started talking about guns, and I noticed that maybe myself, I don't know, maybe I was also projecting, my energy was projecting like that. He immediately got really defensive, started talking about how important guns are, blah, blah, blah. Like he started throwing out data. And I was in it at that moment. I started feeling defensive because I thought we were just, having like a light conversation about guns.
Mm-hmm.
The most interesting part was he immediately labeled me and my other friend that we are anti-guns.
Mm.
We want to take all the guns away. And I was like, we literally, he went from 0 to 100 like that. And only like after he rant whatever, and my other buddy was like, my other friend, he's a businessman, so he's always about compromise. So he was saying that, okay, yeah, like we understand that there's the extreme right and left. How can we compromise and blah blah blah. Maybe have more background check and stuff like that. And he even become more defensive. And
Mm-hmm.
at the end, and finally, other friends chip in and try to break it down. At the end, I told him that, like, hey, buddy, you know what? Half of what you said about guns, believe it or not, I do agree. You know, because one point he was saying that like every single people, like sex education, every American should get education on guns, and I believe that. Like I believe that if there's more better education on guns, if everyone have an opportunity to learn about guns, to hold it and shoot it. Because personally, I went through that. I had like a really good friend taught me about guns, the rule of guns and everything. And afterwards, I have more respect for guns. Therefore, I don't want to have guns.
Yeah.
And so, and I was like, that is example. I agree with you. I think we should have education. We should have, and he was talking about, even while he was talking about, he said that he agreed with stricter background check. I'm
Mm-hmm.
like, yeah, I'm bored. And I told him I don't think, even from practical perspective, there's no way we can take all the guns away. There's no way. So we were talking about, and I told him that, what, personally, on a very personal level, because I'm a dude, grew up with action movies. I love guns. I love explosion and all that. But at the same time, I don't like guns. I see how devastated guns can be. So
Mm-hmm.
how, even within myself, I'm conflicted. Even
Yeah.
with myself, I have to compromise with something.
Mm-hmm.
And he was like, oh, okay, interesting. But he got defensive. I got very defensive too. So kind of like back to that curiosity, that defensive personality, is that how can we, especially right now, all these hot topics, police brutality versus defunding police, tear down monuments, statue monuments, and
Mm-hmm.
all these, how can we have, I'm just curious about how can we have continued what's that saying? Um, cordial civil dialogues.
Right. Um, that's a tricky one. So I'm not, for me, I think there's a really great quote, and I'm paraphrasing MLK's that, rioting is the language of the oppressed. And,
Mm-hmm.
given the historical and current circumstances of what the Black and African American community face,
Mm-hmm.
I'm really not opposed to them, destroying monuments.
Uh-huh.
Honestly, I will say one of the funniest ones was they tore down Christopher Columbus, his monument, I think in Richmond, Virginia. They threw it into the lake, and then Google updated to the monument being in the lake, and I'm like, oh
Oh,
my,
really?
this is freaking hilarious. So I'm not, and for me, I'm like, so then people go like, oh, what about the looting? I'm like, I'm not pro looting, but like, let's actually step back and see what is being looted and who's looting. When you really
Yeah.
look at the demographics, the people who are looting, they're not the locals. The instigators are not the protesters. And I always say like opportunistic people are opportunistic. There's no getting
Yes.
around it. You know, um,
And I'm sorry to inject. And when you watch more and more videos, turns out the most looters are white people.
exactly. So I was like,
Yes,
you know,
Joe
and
Rogan even talk about Joe Rogan make fun of like, oh my God, these looters are white people. Make me like,
I know. I mean, honestly, it's like, yeah, they're white, and so it's like, what are they? What are so? And but there was this one case. I think it was in Philadelphia. It's the loot, like what it was, what Black Americans were looting. They went into a pharmacy and they looted drugs for type 2 diabetes and other like chronic diseases. And I remember just thinking, talking about health equity, it's like, is medication affordable for people? And this, so when I say like writing is the language of the oppressed, I really mean it. It's like, and like, let's see what they're looting. It's like they're looting medication that they can't afford. Like these medications are insanely unaffordable if you don't have health insurance. And this, from a public health perspective, I go like, so one of the things that really pissed me off about one governor, it's not just angered me, pissed me off. I think it was Ohio, but of course it's Ohio.
yes,
Like,
yeah.
the governor or some high-ranking politicians said, well, people of color are dying at higher rates of COVID because they're not washing their hands. And I just made me so fucking angry because I said,
Yeah.
fuck you, dude. Like, that is not how it's working. I'm like, that's not at all. Because it's one of those things. I'm like, damned if you do, damned if you don't. Black
Yeah.
Americans get blamed all the time for their health. It is such crap. Still in medical schools, a risk factor that is still being taught is if you're Black. That's
Yeah.
insane. There's nothing, a risk, like, you cannot change being Black your skin
Yes.
color.
Yes.
What? Yeah. Oh, go on.
And I just want to throw this data in. Yesterday, I was on this webinar by Mental Health of America.
Mm-hmm.
And one of the presenter was saying that there is data after data. So this is not something people just made up. They have accumulated 20, 30 years of data showing even doctors, when they treat patients, there's a lot of implicit bias, well, a lot of bias. So
Oh,
when
yeah.
they treat patient with like patient of color, especially Blacks and Hispanic, maybe even Asians, they treat them differently, not because they have different symptoms, but because of race.
Yes.
They would prescribe differently. It was same symptoms and sign signals. They would prescribe differently. And when you look at the time, how much time they spend with them. So on average, what each doctor visit is 15 minutes, 8 to 15 minutes. With white patients, it's almost always that 15 minutes. We're closer. With patient of color, it's like around 8 minutes. And
Yeah.
there's again, even 15 minutes of doctor visit, that's not good enough. That's not even long enough, you know. So yeah. So
Yeah, no, it's true. And you know, when we're talking about like, you know, long-term change, you're like, you know, I am all for it. I'm like, look, I'm all for the protesters. I'm all, yes, absolutely behind Black Lives Matter. And like, you know, how can we keep this conversation going? Because Black Lives Matter isn't just about police brutality and over incarceration, over policing. It's all about health equity. It's about housing equity. It's about every kind of equity, educational equity. Um, but you know, in terms of like COVID, like how these are two public health crises. You know, police brutality is a public health crisis.
mhm.
It, you know, is such in like I think I mentioned last time, 1 in 1,000 Black American men will die by police brutality in a given year. That's the same statistic as how many people died from measles. When that statistic came out from measles, people are like, this is too much. Gotta like, you know, we have to create a vaccine to eradicate it. Why is there no urgency in that when it comes to police brutality against Black Americans? You know, I
Mhm.
ask that. So again, that's, you know, when you talk about racism, that's racism at a policy level. We're saying like, it's not important, you know. Measles, important. Black Americans getting murdered by police, not important. You know, but the same exact statistic of mortality. So I was like, and then in terms of, you know, health equity, but let's talk about, are Black Americans able to integrate with the healthcare system at large? And I would say no, they're not.
Mhm.
So when you see higher cases, like, you know, I know for a fact that Black American women have higher rates of stage 4 breast cancer, and
Mhm.
that's a stage of breast cancer where you were like fucked. You know, you're gonna
Mhm.
like their survival rate is low. They have a much higher rate of stage 4. And then, you know, I know some people are like trying to biologicalize everything. We're like, you know, is it the genetics? I'm the type of person in terms of how I approach these problems. I'm like, when we get to a point of equity, of true equity, where people can really integrate equally with the healthcare system,
Mhm.
I think it would be a good time to talk about genetics. At the moment, the reality is that Black Americans, and you know, especially Black women, cannot integrate with the healthcare system well. There are so many barriers in place, you know, racism,
Mhm.
bias, you know, not even being seen by a clinician, you know, where of
Mhm.
course by the time they get seen for stage 4 breast cancer, it's too late, you know.
Yep.
I mean, Serena Williams is an amazing, one of the most high profile athletes, and she almost died in childbirth.
Mhm.
Why? You know, like why is this happening? It's not genetics. You know, I actually, if anything, I'm like, she is like, God likes genetics. I'm like, that's amazing, like how she's able to, you know, perform like that in tennis. Um,
Mhm.
but yeah, it's one of these things. I'm like, from a public health perspective, we're not things are not equitable. And then like we're like, well, how are things not equitable? Like in an even better example, it's like private versus public insurance versus no insurance.
Yes,
You know,
yes.
like let's you know, in the United States, your insurance status is tied to your employment status, pretty
Yep.
much. How is that equitable? If you work
Exactly.
part-time, or if you're at like a low-paying job, you know, you ain't getting insurance. You know,
Mhm.
you just ain't.
Yeah.
And
And right now, and then even right now, there's massive unemployment. So as you
yes.
know, back to that, employment tied to health insurance.
Mhm.
And with the preliminary data that I've been seeing, out of this mass unemployment, which demographic has a higher unemployment rate? The
Yeah.
blacks and the
Yeah.
Hispanics.
Yep.
So
So
we're talking about they're unemployed and they don't have health insurance.
mhm. And this is an ongoing reality, and that's why it is so annoying when I hear all lives matter. I'm like, well, clearly our system does not prioritize all lives. And
Yes.
you know, like that's the thing. I'm like, I don't. For me, it's like if you see this data and then you justify it with like, oh, it's their fault for not getting a better job. It's their fault. I'm like, at that point, I'm like, as kindly as possible, I have no patience for you. You know,
Yes.
it's like because my you know, and I think a couple of weeks back, I talked about having a depression episode in terms of what am I doing? Am I doing enough? And blah, blah, blah. And, you know, when it comes to, you know, using your energy, when so much is going on, I'm choosing to use my energy towards something that is constructive. Now, and I, you know, so when it comes to like I'm not here, and certainly, you know, definitely not Black Americans or like, you know, people of color are not here to hold a hand of someone who is purposely ignorant to make them a better person. I'm like,
Yeah.
and as kindly as possible, like, there's so much other work to do. Like, if you can't even do something as basic as have some empathy and have some curiosity to understand what the hell is going on, you're on your own. You know?
Exactly, yes. And I think a lot of people that also keep saying that all lives matter because I think they're part of their mentality, they're stuck in equality.
Mm-hmm.
So for people that out there, if you don't know the difference between equality and equity, here's a definition. So, and this happened too. Just even a couple of weeks ago, I posted a video of talking about equity. And my friend texted me, said that, are you referring to, he said, I think you spelled it wrong. I think you are trying to say equality. I said, no, it's equity. He said, no, equity is investment with shareholders' stake in a company. I'm saying, yes, that's true. But equity right now, especially in diversity and inclusion, in the social understanding, is different. It's not stakeholder. It's not an investment of a company. So equity is, so I'm just telling the biggest difference between equality and equity is that equity provides everyone what they need to be successful. So this can be systematic issues like education, accessing to grocery stores, public transportation, healthcare. Equality is treating everyone the same. Equality aims to promote fairness, but it can only work if everyone starts from the same place. Same place, it needs the same help. So this is the key word. It means that equality means that everyone starts from the same place. And this is not. So equality doesn't really work. One simple example was back in college, I went to pretty fancy privileged university.
Mm-hmm.
So almost a lot of my friends came from pretty good family. So wintertime, what? Wintertime, their family, they can afford to get a ski pass and go ski, snowboard. A lot of their family, parents have a second home in the mountains that they can spend weekends at. And
Mm-hmm.
some they even have boats, some they have second house. And during spring break, they can go on vacation, go to Cancun and party. Summertime, they could travel abroad. They go travel internationally. And on top of that, they can study abroad.
Mm-hmm.
People like me and other students, also American students, we had to work during spring breaks, winter breaks. We couldn't afford to go ski or snowboard. We couldn't even afford to get like a fucking snowboard. That thing is expensive.
Yeah.
We had to take summer classes. At the same time, we had to work summertime. So just using that one simple example, we did not start off equally.
Mm-hmm.
So this is the word equity. So that is what Q you're talking about, equity. Is that yes, we are all different. Our starting points are all different, which is okay. Okay, yeah, okay mean that this is a reality. But how can we ensure that when it comes to education, healthcare, not getting killed,
Mm-hmm.
safety on the street, how can we be equitable? How can we be safe?
Yeah.
So
I know, and I think there was I help out with these webinars for work about once a week, and there was a few weeks ago we had racism in maternal health, during COVID, and it was a really great one about how does racism play into healthcare setting and maternal health for Black women, and especially during COVID. But one of the panelists said that equality can exacerbate existing inequities. If you only focus on equality, you can really exacerbate existing inequities. We can only, so I think I'm like, as much as I understand the good intention of emphasizing equality, like, oh, everybody's in the same boat, like, I can make fun of anybody. That's the reality is like, no, equity accounts for power dynamics and power differences. And that's the thing about equality. Equality does not account for power dynamics. At the inherent heart of racism, sexism, every kind of terrible ism is a power dynamic. And equity is goes, these are the realities of power dynamics, and this is how we address it. One of the things that I got to say, it's like, I want to believe majority of people work hard, but the question is, does that hard work accumulate into like the same long-term gain? Like, let's just say like a Black American who works very hard, works 3 jobs, part-time jobs. They grew up in, West Baltimore, which if you're familiar with West Baltimore, it ain't pretty, like I'm not going to sugarcoat it. It's just a lot of intergenerational poverty, intergenerational trauma, lots of problems there. And, they're working hard, working 3 jobs, trying to go. But then let's look at the larger reality, is a food desert. So they aren't getting the proper nutrition. They not getting proper nutrition. Where's the opportunity to go to community college? Well, they don't, because they're working 3 jobs to help their family. So it's like all these things. I'm like, that's why things are like not equal right now. Not only things unequal, but like in that person's scenario, no amount of hard work on an individual level is going to change the larger systemic unequal inequities that surround them. Their hard work is less likely to accumulate into long-term wealth than a white person who was born in Beverly Hills and doesn't have to worry about being in a food desert, doesn't have to worry about not being around, like not going to college, doesn't have to worry about student debt, doesn't have to worry about, honestly, a lot of shit, And these things accumulate over time. It is not to say like that a white person born in Beverly Hills is not working hard. No. I'm not saying they don't work hard. Like in this hypothetical scenario. What I'm saying is that if they work hard, the probability of their hard work accumulating into long-term wealth and success is much higher than the person born in West Baltimore.
Yes.
That is, when people, there's an app company, typical Silicon Valley, that developed this app, or is developing this technology to determine, like, we can determine your IQ, if you're a genius based on whatever. I don't know, it's something dumb. And then someone responded, you can already do that with a zip code. And that's true. Your zip code, it was one of the best determinants of your lifelong success rate and wealth accumulation. Oh, go on.
Oh yeah, there's a website, and you can type in the zip code and you can see, and it's just crazy. It is.
So that's why, I mean, as much as I understand the good intended impulse to say, I want equality, I'm like, oh, we ain't there yet.
Yeah, we're not
like,
there yet.
It's, I think the best analogy I've seen is like, like let's say like this is infographic that circulates around. It's like a fence, right? And then there's these 3 people who are trying to watch a baseball game over the fence. Equality is that, all 3 of these people, they're all separate heights as well, like, tall, middle, short. And then equality is that they all get the same size of the stool to watch.
Yeah,
so
they all stay on the ground equally.
Equally. And equity is like everybody gets a stool that allows them to see the baseball game at the same height. So the shortest person gets the tallest stool, the middle person gets like, in between, the tallest person gets like the smallest stool. They all get stools, just stools that account for their height. And that is a really important description, to be like, hey, this is equity versus equality.
Yes, yeah. And what I remember a couple of years ago, someone used this analogy. Again, I live in Denver, Colorado. There are mountains here, and families do have second home or a little cabin in the mountains next to resorts and stuff like that. And she was using this analogy that these families that have houses up there, they might inherit it from their family, from their parents, passed
Mhm.
down. Just using this one example, you can sell one of those units easily nowadays by ski resort easily 200, $300,000.
Oh, wow.
The size of my apartment, one unit can sell up there that
Mhm.
much money.
Wow.
So just imagine your family accumulate this wealth, which they work hard. They probably work really hard. But when it comes to this generation, one simple example, that using, for example, my friend, he could sell that family house up there
Mhm.
if he experienced some medical emergency. So worse to worse, he did not have to go into debt. He still can get treatment, get healed, recover, have extra money for home care, whatever. People that without that equity,
Mhm.
that literally an equity, a real estate up there, people like that would go into $300,000 in debt for medical bills.
Mhm.
They might have to risk their health to try to get a job. So just using that one example, you can see the disparity right there.
Yes.
And again, I'm not dinging my friends' family having a house up in the mountain. I'm not good for them. I'm like, go enjoy that fucking mountain, that house. It's beautiful. But the challenge, I think what Q are talking about is also the medical system. Our system of work, you know, our medical system is so expensive that people are avoiding, try to avoid getting checked up, going to hospitals, even though they are sick.
Mhm.
And when you look at people of color, black people that are socially economically struggling, to avoid that. What does that tell us? If that means is that their health continue to deteriorate.
Yeah.
Cannot perform better at work. And what this country only offers like 10 days, 14 days sick leaves and vacation
Yeah.
days. So they cannot even take care of themselves. They have family. They might have older parents to take care of. So we're talking about this is cycle health. So I think ultimately what we're advocating this health equity is that, just using our healthcare system, how can we provide the best and most affordable healthcare,
Mhm.
not just for the people that are privileged, but also for people that really need it. And like what you were saying, the conventional argument against that is that like these people, i.e. the black people, they are lazy, they don't work hard, therefore they don't deserve it. And
Mhm.
fuck that argument. I think that
I know.
argument,
It's like I don't have any patience for that.
yeah, it is, how do we know that they don't work hard? That this again, I think this is a prejudice, a lack of curiosity from more privileged people, just easily label other people that are lazy, they don't work hard. Therefore, we as a society, we, the government, do not need to invest money on them.
Exactly. And like you to that argument is my most generous response is fuck you.
Yeah.
I have some of my closest friends are in Baltimore right now. They're from originally California, and
Hmm.
they've chosen to stay in Baltimore than as opposed to coming back to California. So to a lot of Californians, that sounds insane. I'm like, what? California, Baltimore? I love and respect them deeply in terms of their decision. They've chosen to stay in Baltimore for a variety of reasons, but one of which they said like they're all clinicians. They're like my skill set is needed here.
Hmm.
You know, like one of my friends, he's a director of his health clinic. And it's a high stress job, and he serves a predominantly like poor Black community who just. And I remember, I was talking to my other friend who they're married. So my friend is the director, and his wife, and they're both nurses. And, I was asking her, I was like, because she said, like, yeah, he's really stressed out and it's hard. And I'm like, this is he's going to get a break or anything. And she said, like, he works so hard because he also knows at the end of the day, they have nowhere else to go.
Yep.
And for me, it's not one, it just result. I'm like, man, I really love my friends and I respect them so much. They are just, you want to talk about noble causes, like these, you want to talk about health equity. My friends on the front lines have been like, to really lift that up. That shit is inspiring, you know?
Yes.
And really also heartbreaking. And it's like, for them to know like they are the only thing for this community, because I'm like, if that clinic closes, that community has nothing. And that is a very stark reality that a lot of privileged Americans do not know. In that case, you know, when it comes to healthcare, I'm insanely privileged. I work at USC. We have we don't get paid very much, but our healthcare benefits are insanely good. Yeah. So for me, I was like, I'll take that because, so for me, I'm insanely privileged because, like, let's say, you know, I need to go to urgent care. I can go to any urgent care nearby. That is not a reality for most people. They'll be like, oh shoot, will my insurance cover this or blah, 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 you know? And I want to get to the point in the near future, you know, I want this to happen before I pass away, but I want to get to the point that where what I can do right now applies to everybody. And we are nowhere near that, you know, and because, like, you know, I have the healthcare insurance where I can do that. And that's like, I cannot emphasize in the United States, for people who are watching this who aren't in the US, they're like, what are you talking about? Like, I want to emphasize the United States, that's insanely privileged, you know, like to go anywhere and not worry about is my health insurance going to cover this?
Exactly.
Yeah, because I can prioritize my health as opposed to, you know, oh, is my insurance going to cover this?
Yes.
That is privilege. That's something that a lot of people don't know about.
Yes. And part of that privilege, or part of that health equity, is that, and we can probably connect it back in a more positive, happy note, is that one thing I noticed since the whole pandemic started is that from the government perspective, from the public health perspective, I think the messaging was kind of weak, or was not good, because the whole messaging telling what people to do is pretty much stay at home, don't go outside, quarantine, like a lot of no. And what I'm disappointed is that, like, okay, tell us what we can do. And there's things definitely we can do. One thing is, why can they put out more information on how can we boost up our immune system? You know, talking about preventional health, you know, talking about, you know, instead of just, no, don't do this, don't do this, don't do this. Maybe, you know, I something like drink less, eat less sugar, eat healthier, stop smoking, or smoke less, go outside more, go on walks more. Because these things ultimately can boost up our immune system. You know, ultimately these things can help us maybe prevent, or even if we get COVID-19, it might help us to, instead of dying, it might help us less severe, the symptoms and signs. So I think what I think the point I'm trying to say is that on the flip side, there are things that we can do in our lives that can help us to battle, you know, even though, yes, the health inequality, inequity are out there. But I always like to turn it within. That, like, okay, what can we do? Just little things. I'm talking about little things that we can do to improve our health, to improve our mind.
Yeah, and I think you tapped into a great point about, like, you know, when you see so many things that are just so unfair and beyond your control, the big question is, like, what do you have control over? You know, you have control over what you choose to eat. You know, when I was going through depression. One of the things, the lifelines for me during that was, one, the first is to identify it was depression. It's like, it's not just a headache, this is depression. Then the second is like, all right, what do I have control over? And like focusing on what I had control over versus what I didn't have control over.
Yes.
Helped tremendously, and I remember at one point I was like, I am choosing to ruminate on what I'm currently feeling, not I am overwhelmed by what I'm feeling, like little things like that. And then, even in terms of food, I and people deal with everything differently, and how you deal with stress, go for it. There are people who are like, who stress eat, and just remember, I'm like, yes, it's understandable, it's a coping mechanism, but also remember that what you eat is what you choose, what you eat.
Yes.
And just remember that every choice, and in terms of like stepping back and like, you just remember what you can choose. You can choose to vote locally and federally. But really, these small choices have huge implications. And it's, back to like my U.S. history teacher, when my classmates were just mad, like, tell me how to get an A, they just didn't understand. They weren't understanding like the long-term intellectual return,
Exactly. Yeah.
And just think about like, yes, these small things, choosing what to eat, choosing, vegetables over pizza. And it's not to say like, oh, don't eat pizza ever. I'm like, you want to eat a pizza? Eat a pizza. Like, just know that you're choosing to eat it. You're not forced to eat it. And then if you don't like how you feel after eating like a whole pizza, you don't have to choose that option anymore. There are choices.
Exactly. Yep.
Yeah, and and this, I'm also saying this from a position of privilege where like I can choose stuff. So, again, it's like these little choices every day of like, what can I do? And so this is very much for people who are like in a scenario where they're seeing everything happening and like, what can I do to help ensure long-term change? Well, continue learning. Like, really, it's a choice to continue learning.
Exactly. Continue learning. Back to that whole curiosity. I was reading that the most valuable assets in our life are two things. One is time. Second is our mindset.
Mm-hmm.
Time. Okay, I think I say it wrong. The most valuable asset that we have no control over, that we have little control over, is time. Time, you just keep moving.
Mm-hmm.
But the second most valuable asset that we have control, especially control time, is our mind. And I know that, like, again, speaking for myself too, when I was going through depression phase for years, like I was facing so many different hardship. I was getting beat down so much. But one thing I realized that, the biggest asset is my mind frame, how I frame it. Even though we could go through hard, challenges, hardship, which is totally, understandable. But instead of feeling or seeing yourself being defeated, how can you turn that around a little bit and making little by little positive choice in your life?
Exactly. And to like, again, on a more positive note, my cat wants attention. So yeah, these are really difficult conversations and difficult things to grapple with. There's a lot of uncertainty. But like, when we talk to health equity, it's like we just talked about systemic issues. It's like, well, what can I do individually? Wear a goddamn mask.
Yes,
it's like, let's talk about like, you want to help on health equity, right? The idea of mask is like, you're trying to help people who are more vulnerable to you, immunocompromised wise, from catching COVID, because while you may not necessarily die from COVID, someone else can. So by wearing a mask, that's you saying, I care about other people. I am showing care. By you choosing to not wear a mask and coughing on people, you're an asshole. It's like, you know, yeah, like when, you know, like Black Americans are dying at higher rates of COVID than any other demographic in the United States. So you really want to, on a personal level, you want to battle that health inequity, wear a mask. It's very simple. Wear a mask and follow public health guidelines.
Yes.
You know, maintain physical distancing. You know, you can still social, like physical distancing from others. Wear a mask. Be responsible. You know, like be personally responsible because there are other people's lives at stake.
Yes. Yeah. Exactly. And I love that. You know, it's just simple thing, wear a mask, little, and we're talking about little, let's focus on little things, little healthy. When I coach my clients, I always say that if you want everything, you get nothing. Like we want to have health equity in our country. That is a huge vision, but let's start something. Yeah, when you want everything, you get nothing. But if you focus on just one or two things at a time, the chance of you succeeding is really good. And each time when you focus on just those one or two task things, you accomplish those and you focus on two more, you accomplish those. Couple of years later, boom, we are closer to health equity. So don't overlook, you know, little things like just wearing mask. Fucking wash your hands, man. Just wash. Jesus.
Yeah. The washing your hand thing, I'm like, come on, that's gross.
Yes, and this is how scary when the whole pandemic happened, and you realize that, oh my God, how many people don't wash their hands?
I don't want to think of it.
I know, you know, I'm just talking about these basic, you know, basic little things, you know, and then we can also lend that, you know, education. Be curious. You know, if you don't like to wash your hands, if you don't like to wear a mask, just kind of ask yourself, like, why is that? You know, why is that bothering so much? And ask that, like, why is this so important? Maybe you don't give a shit. Maybe it's not important to you. Kind of just be curious about why this washing our hands, wearing masks could be important to your neighbors, you know, to your fellow citizens. So.
Yeah, no, I mean, it's like these people need to remember that, you know, like these big structural changes came from, you know, an accumulation of small acts.
Yes.
Really did it, you know, and then it's like, oh, if you don't know what these small acts, it's a perfect opportunity. You're curious, go learn about it, you know, look at these small acts that people did, and really you know, it's just remember, it's like you may not be the president of the United States, but man, you can do a lot more than you think you can.
Probably, yes, exactly.
Yeah.
So yeah, I think this is a good point to end. So, all right, thank you so much. Yeah, thank you, Q. And yeah, until next time, enjoy your weekend and talk to you all soon. All right, bye.
Everyone. Bye.